Hi, this is my video on joint movements, and I'm using a sock monkey missing an ear, but he's nice and flexible, so I thought he'd make a good model for showing some of these movements. Okay, the first two we have are flexion and extension. Flexion is a decrease in a joint angle on the hinge joints like your elbow, your knee, and your wrist, and that's really just a fancy term for saying you're bending that joint. Okay? And then extension means you're straightening that joint. You're decreasing the angle. Abduction and adduction. That's moving a body part in the frontal plane away from the midline. Means you're raising your arm, could be your leg, out to the side. That's abduction. And adduction would be moving your arm back toward the midline. We also have protraction and retraction. This is the movement of a body part in the transverse or horizontal plane. And the way I see it is moving your shoulder forward. You're kind of not flexing, but you're moving that joint forward. You can also be jutting your chin forward on your vertebra. That's protraction, and then retraction is putting the joint back. Okay, we have circumduction. This is one end of an extremity that remains stable, while the other one makes a circle. And when I looked it up, it's kind of like making a cone. The top of your arm at the shoulder is the top of the cone, and you can make a circular movement, and your hand creates the bottom of the cone. Next, we have rotation, and that's where a bone spins on its axis, or it pivots. That's like taking your foot and turning it inward. Then we have supination and pronation. Supination's the movement of the palm, and this is kind of like your anatomically correct position. The palm is facing forward, or if it were resting on a table, it would be facing upward. Pronation is the opposite. That's where your palm would be facing down on the table or facing backward towards the posterior. The last two are dorsiflexion and plantar flexion. Dorsiflexion is like taking your foot, pointing your toes upward, almost like you're going to paint your toenails. And then plantar flexion is pointing your toes downward, kind of like a ballerina. And that is my presentation on joint movements. Thanks for watching.